Our next guest, Dr. Jolanta Lukawski, is the medical director of the Sue and Bill Gross Women's Wellness Center at Hoag Hospital. She's here to talk about vitamins and supplements.
In both her practice and research, Dr. Lukawski emphasizes integrative medicine. This is a combination of both conventional and alternative approaches to health. Jolanta, thanks so much for coming to Health Matters.
Thank you.
This is, really a hot topic. Patients ask about it all the time. What exactly is integrative medicine?
Integrative medicine is combining the best of both worlds. Traditional medicine, which is what you see your regular doctor for, a family practitioner or primary care provider, as well as alternative modalities, vitamins, supplements, nutrition, meditation, exercise, and it's using the best of both worlds to have a patient feel whole from the mind, body, spirit, and community, so they can actually participate in life fully.
So your training has been traditional. You're an internist, and you went through internal medicine residency, just like I did. And then you decided to do additional training with Andrew Weil, who's actually the guru of integrative medicine, actually, and you probably had the best training you could possibly have with him. And so you put these together, so you can do everything that a traditional physician can do, plus you have this expanded knowledge of alternative treatments. Is that right?
Correct. I did a 2-year fellowship under the direction of Andrew Weil at the University of Arizona. And what we learned to do is integrate, again, integrative medicine, these alternative modalities. So I still practice traditional, regular medicine. However, I do incorporate the use of supplements with my patients, and I partner more with my patients for healing.
So if somebody has high blood pressure, for instance, they're not going to come in there and you're going to say, stop all these medicines and put them on some other type of alternative thing. You're going to do what?
No, stopping medicines is always the goal, but we don't stop it. And the patients know that we may never be able to stop it. However, we look at what we can do. Exercise and diet can impact blood pressure. Mind-body techniques. Meditation can lower blood pressure. We've known that since the studies from 1960s. Biofeedback can lower blood pressure. And then supplements such as calcium, magnesium, and high potassium diets all can impact blood pressure, which can maybe decrease the amount of medication they have, and if possible, maybe stop in a future when they're more stable.
Jolanta, many people are under the impression that vitamins and supplements are not as potent or are better for you across the board than traditional forms of medications. Can they be dangerous, or are they all safe?
Vitamins and supplements need to be looked at as medicine. Sometimes you can even get the same vitamin supplement in medicine form in higher doses.
Oh,
so
really?
if you take a lower dose, if you take enough pills, you're taking a prescription medicine. And you also have to look at how it was made, the company, the quality. It can be toxic, and it can also interfere with your regular medicine. So you have to look at what the medical problems are, what medications a person has, and then prescribe the appropriate supplements or vitamins as needed for the patient.
So you're really, to be safe and to be effective, you really need to have a physician who lives in both worlds, because there is that potential dangerous interaction, and you need to know when to back off and not stop the traditional medicine. You need to understand both traditional medicine and this. So what kind of person seeks you out? Is there a certain type of time in their lives, somebody in their 60s or when they're going through, what type of person should seek you out, for instance?
The type of person who normally seeks an integrative medicine practitioner is usually in their 30s, 40s, or 50s. They may have experienced a life crisis, a health crisis, or be in transition, and they want to start taking responsibility for their health, or they may have a condition that they now have to figure out how they can be healthier with this chronic condition. Patients can range from having cancer to some of our more chronic problems like arthritis and fibromyalgia. There are people who just want to figure out what they can do to feel better and to live healthier and live longer with less disability.
Why don't we pick a few of the hot ones, or the more common ones that everybody, say menopause, how would you, what would it be? Is that a good approach for integrative medicine?
Menopause responds wonderfully to integrative medicine. We know the triggers for menopause can be diet, stress, a lack of exercise. And so what we do with menopause is we actually do a multifaceted approach. We encourage stress reduction with meditation or guided imagery. We encourage exercise such as yoga to help keep the body lean and to decrease the stress as well. And supplements, flax seeds, ground flax seeds, have ligands which actually help with hormonal balance. Black cohosh has been studied and has been shown to help with hot flashes in therapeutic doses. So those are two supplements that can be prescribed for the hot flashes. The other symptoms of menopause, such as insomnia, can also respond to certain supplements, such as the calcium and magnesium can help people sleep, or even 5-HTP, which is a precursor supplement. So menopause does really well with supplements and an integrative approach.
Do you ever give them like bioidentical hormones, like, or no?
Bioidentical hormones I also prescribe, and they are also in the integrative medicine cachet. What's nice about bioidentical hormones is that you can dose the medication according to a patient's blood sample and how they're feeling, so you can use smaller doses of the medicine. However, even with bioidentical hormones, we have to make the assumption that there is the same increased risk of breast cancer, stroke, and heart disease as there is with regular hormones.
Now, when a patient comes to you, do you do an entire workup on them as a traditional doctor would? I know you're a traditional doctor as well, but in part with your vitamin scheme, or?
The evaluation is more in depth. Our history can take up to an hour. We really look at a patient completely, what their childhood illnesses were, what stress levels they have in their life, what their exercise pattern is. So it's a truly complete history, which can take up to an hour. And then we do order specialty lab tests. We just not only check the regular panels that your doctor might check, but we check certain vitamin levels, we check certain what we call fatty acid levels, and they help to determine what supplements a person will respond to and needs.
So besides menopause, I would imagine fatigue is another, I mean, not everybody complains of fatigue. That's probably a very big one for you. Is that not right?
Fatigue is very big, very common among women, especially perimenopausal women. Has also to do a lot with the current stress and the lack of diet, proper diet, as well as lack of exercise. Again, response to an integrative treatment plan. Fatigue is one that I counsel a lot about nutrition, proper nutrition. The diets that people eat right now are so processed that it's depleting a patient of their energy levels. It's not providing them with the building blocks for a healthy body. So by really counseling them about the nutrition that they need and getting them to move a little more, because when you're tired, you don't want to exercise, that can start them feeling better. And then again, we support their body with maybe some B vitamins, which can help, and even some herbal products, such as maybe ginsengs or mushrooms, some of those types of products.
So for fatigue, ginseng, B vitamins, and mushrooms are part of your armamentarium.
Yes.
And then I imagine arthritis, we all get aches and pains as we get older. Is that another big one for you?
Arthritis is a very big one. It's such a chronic disease, and we know 80% of the population over the age of 50 have arthritis.
Whoa.
And it's debilitating, especially for women. Again, nutrition, the anti-inflammatory diet, very important for patients with arthritis. Having fish oil, omega-3 fatty acids, there's anti-inflammatory components in that can help decrease arthritis. Glucosamine, for the past 10 years, studies have shown that glucosamine helps with arthritic pain and can decrease swelling and help stabilize the joint destruction. Glucosamine is a wonderful product. But for the more acute inflammation, we also have several herbs such as ginger and turmeric, which can help. And again, mushrooms, reishi mushrooms, also have anti-inflammatory benefits. So with arthritis, the benefits from integrative medicine with supplements are tremendous.
So just briefly, what is the anti-inflammatory diet that you?
The anti-inflammatory diet is it's quite popular among patients who have arthritis or any of the cancers, because it decreases the inflammatory load on the body, meaning you're eating foods that are more natural and the body does not react negatively to it. So you're eating more fish, less processed foods, no foods that have trans fats, which is partially hydrogenated vegetable oil, no foods that have artificial colors or artificial preservatives. You're trying to avoid foods that can actually stimulate the inflammatory pathway in the body. Those things tend to be dairy or even meat. You want to eat more fish, more plant-based diet, whole grains, vegetables, to really keep the body in a very anti-inflammatory neutral state.
Well, we're about out of time right now, but if you were to give the one helpful hint that everyone should know about for better health, what would it be?
See your integrative doctor and have your vitamin levels checked so you can figure out what you may need.
Okay, thank
Great.
you so much for for coming on our show. We were delighted to have you.
It was very interesting. Thanks for coming on Health
Thank you
Matters.
very much.
Thank you.